This is the hospital where I work in. It's a brand new hospital now. It's called King's College Hospital, a branch from London, in Dubai now. We'll start with the first study, which is Canvas. And in Canvas, what they have is is to answer the question, is combining aspirin with low dose anticoagulation will be better than aspirin alone or anticoagulation alone in patients who have coronary artery disease or peripheral vascular disease. So they have 27,000 patients. I don't know if this is not working. Anyway, 27,000 patients divided to 3 groups. One group they have given low dose rivaroxaban plus aspirin. Other one is rivaroxaban, and the third one is aspirin. And they follow those patients for 23 months. Out of those 27,000 patients, there was 7,000 patients with peripheral arterial disease, either lower extremity or carotid. There was a specific outcome for the limb, either major advanced limb events, male, or amputation. The result, there was 46% relative risk reduction in the group who received combination of aspirin and rivaroxaban versus aspirin alone. On those, the male, including amputation. For the amputation alone, there was 70% relative risk reduction. Very impressive, actually. And with a very good p-value, 0.01. There was increased major bleed, but there is no significant increase in fatal bleed or intracranial bleed. The summary of Canvas was rivaroxaban low dose 2.5 twice a day plus aspirin decreased the major adverse event for lower extremity by 46% and decreased the amputation for 70%. Of course, the other primary outcome decreased 28% for the stroke, MI, or cardiovascular mortality. There was increase in major bleed, but no significant increase in fatal bleed or intracranial bleed. This is a picture from Dubai. This is called Miracle Garden, where is beautiful flowers everywhere, one of the biggest in the world, actually. We'd love to have you there and see the wonders. The second study was published recently in September 2018. It's Imperial, which is comparing 2 stents for SFA. There was a 465 patient with a length of lesion up to 140 millimeters, and they compare the Eluvia stent versus Zilver stent, and the result after 1 year showed increased better patency in the Eluvia stent, 88% versus 79% on Zilver stent. So the conclusion, probably Eluvia stent have a better outcome over 1 year period. This is a meta-analysis was published recently in December 2018, and it kind of created a lot of alarming signals. This is there's a Dr. Katsanos from Greece. He reviewed 28 randomized controlled trials, including 4,600 patients, and he looked at the all-cause mortalities. Those patients underwent paclitaxel balloon or stent in the SFA, comparing to balloon angioplasty or bare metal stent. After 1 year, there was similar mortality between the 2 groups. In 2 years, there was significant increase mortality in the paclitaxel group. It was at 7.2 versus 3. In 5 years, there was further increase of mortalities, 14 versus 8. And the conclusion from meta-analysis was there is increased risk of death following application of paclitaxel-coated balloon and stent in the femoropopliteal artery. Of course, that was very alarming, and so the FDA sent a letter to healthcare provider. It says, FDA is evaluating recent information regarding the potential increase long-term mortality after using paclitaxel-coated balloon on a stent. And that was sent in January 2019. And then sent another letter in March 15. It says, our primary review of this data has identified a potential concerning signal of increased long-term mortality in the study subject treated with paclitaxel-coated products. Medicare went ahead and did some analysis, and they have reviewed Dr. Simkes. He published data on February 19. Review Medicare patients, 16,000 patients, and being followed for 600 days. And in his review showed that paclitaxel balloon and stent did not increase the mortality over 600 days, less than 2 years. So this kind of issue still need to close, because the bigger data randomized study, it did show there is increased mortality. This is only for 2 years, less than 2 years, shows no significant increase. So we just need to keep eye on that one and to see if we have some more data on there. Another review from Miracle Garden. This study about lithotripsy, you know, the lithotripsy designed for the kidney stones, and now for heavily calcified coronary artery or peripheral arteries, the technology has been used, and this is a study presented in 2018 with 60 patients, heavily, moderately to severely calcified peripheral arterial disease, and the study showed there's very low complication, 1.7% only, and the patency rate was 62%. And the study, it did show, it can conclude that using lithotripsy in severely calcified peripheral arterial disease, it is safe and effective. Actually, it's also been available for coronary, heavily calcified coronary. The good thing about this technology, it doesn't cause no reflow. You know, with the rotablator, when you kind of rotablate the calcium from inside, the calcium fragment go farther down and close the small capillaries. This one, it doesn't really, it's kind of breaking the calcium in the media of the artery, so there's no reflow. I don't know if you have it here in Morocco or not yet. Yeah. Now, this is another technology, new technology, DARPA, which is destruction of arteriosclerotic blockage by laser radiation ablation, treating peripheral arterial disease. And those two studies were presented recently. One is presented by Dr. Kondor in February 27th in Germany. He presented 52 patients with 111 lesions. He reported success rate 98% for the lesion success, kind of define it as less than 30% residual stenosis. And it was reported as very low complication. Dr. Ansari, he also reported his study in February in Milan, Italy, February 2019. He had 200 patients with 292 lesions with success rate 94%. So this is another technology for peripheral arterial disease. This is a meta-analysis and review of International Registry of Acute Aortic Dissection, and it was presented in March 2019 at the ACC by Dr. Kim Eagle. They have 9,000 patients, including in the study. there is a 13 countries from 1996 to 2019. They compare the diagnosis, treatment in hospital, and 5 years mortalities. And what they found is the CT scan is still the main diagnostic test using for aortic dissection diagnosis. In type A dissection, their surgical management has increased from 85 to 88%. The in-hospital mortality went down from 26 to 16. And 5-year survival increased from 81 to 88%. In type B dissection, endovascular therapy increased from 19 to 31, and surgery decreased from 15 to 6. The in-hospital mortality improved, it was from 10 to 7, and 5-year mortality also improved from 74 to 83%. So from this kind of study, it does show over those years there is significant improvement of the outcome, in-hospital outcome, and 5-year outcome, and there is more endovascular work for the type B dissection. This is an interesting study for treating pulmonary hypertension by using denervation. So it is a randomized trial of pulmonary artery denervation in patients with combined pre and post capillary pulmonary hypertension. You heard about the story before of renal artery denervation for treating hypertension, and initial study showed excellent improvement. Later on, it showed there is not really much significant improvement. Now, the latest study for the renal artery showed it may have some potential improvement of hypertension if in selected patient. Now, this study was presented in September 2018, putting a catheter in the pulmonary artery and apply the ablation to the nerve in the intention to denervate the pulmonary artery. And the idea, if you denervate the pulmonary artery, you decrease the spasm or the tension in that artery, relax the artery, and decrease the pulmonary pressure. They have a 96 patient with mean pulmonary artery pressure is more than 25, pulmonary capillary wedge pressure more than 15, and vascular resistance more than 3. And they compare those patients with pulmonary artery denervation versus giving the Viagra. Primary endpoint was increase the 6-minute walk and change in the pulmonary pressure. 6-month result, it showed there is increase 83 meters in the denervation group versus 15 meter in the Viagra group, and there was decrease in the pulmonary arterial pressure. I think it's done, right? Okay. Well, thank you very much. I have a few more studies, but we ran out of time. Thank you very much.
Merci, Dr. Halek, pour votre présentation.